Sorry, we could not do it at 3 o'clock today because there was a lot of rush in the OPD. So we have postponed it for half an hour. I hope you must have seen the notification on the Facebook about the delay of half hour of the YouTube. So I hope everybody joins in fast and early, and then we can start the YouTube and Instagram live both. Yeah, welcome, Dr. Birwalia. Birwala. Uh, let's have. There is some disturbance in Instagram. Maybe we'll manage that, and on YouTube it's okay. So let us start the YouTube live and Instagram live. Dr. Mohan, welcome. Dr. Meera, welcome. Dr. Ruhi. Yeah. There was an interesting case. There was a case of backache. Let me tell you, there was a case of backache. And normally, whenever we have backaches, course of symptoms of backache and all, we normally think about the remedies which are usually indicated for backache, like we have Rustox, we have Macphos, we have Guaiacum, Gultheria, other remedies, Calcarea, Carbon, Phosphorus, and all. But as I always say, good afternoon, Dr. Smita. As I always say, it is very important to understand why the backache has occurred. There was a very interesting case in my OPD, which we also took the case. We prescribed a medicine, did not work. We changed it once, we changed it twice, we changed it thrice, but it did not work. And then when we got the cause of backache, the backache was because of grief. The patient has a clear history that the backache was because of grief, and a simple remedy. Welcome Dr. Ghazala, Dr. Nigam. A simple remedy, Naja 200, cured the case. This is the importance of understanding and taking the case. Case taking is important. As I always say, that case taking is very important. If you can get the cure, if you can get the cause of the disease, like in this instance, we had a clear cut indication that backache was because of grief, and Naja cured the case. One of the case I remember, yeah, welcome Dr. Belwalkar, Dr. Alexandra, Dr. Shivastava. One more interesting case which I remember, the patient came and told me, since I have started fasting, I am getting backache. Remember the wordings of the patient, since I have started fasting, I have backache, though I have reduced 5 to 6 kgs in about 2 months, but the backache is now very severe. Doctors have prescribed me painkillers, vitamins, and multivitamins because I'm fasting, so I'm taking calcium, vitamin B. Still, the backache is not going. So, what? Please give me some medicine. See, yeah, welcome, Dr. Babel. See, a very interesting case, a very, very interesting modality, a very, very interesting symptom. Which remedy comes to your mind? Anybody? Of course, in that case, also we found that the patient might be doing fasting. That's why his calcium had gone down. So he was taking calcium, he was taking vitamin D3, he was taking B12, he had taken these all tonics, but the backache was not going. But the simple dose of a medicine prescribed in 200 potency, I think I gave him 2 doses and the backache vanished. This is the importance again of having a clear cut history of the disease which the patient is presenting in front of you. Welcome, Dr. Navchut. Good afternoon. Dr. Riaz. Good afternoon. Dr. Arora. So I prescribed the remedy. Anybody can anybody guess the remedy which I might have prescribed the remedy? These were the only symptoms of the patient for which I prescribed the remedy. Anybody? Can you guess the remedy? Simple remedy, simple cases, because I had a lot of cases of backache, Good afternoon, Dr. Nigam. So which remedy comes to your mind? Anybody? We have lots of remedies, when the patient comes and tells you, yeah, lycopodium, when the patient comes and tells you that I have been lifting lot of weights, weight. मैंने वजन उठाया, I have lifted weights and I have suddenly got backache. So there are a lot of remedies. We have calcarea, we have graphitis, we have lycopodium, we have rustox. But that is because of lifting. Here I am telling the patient, and you will get a lot of cases in your practice also, that because of fasting, he is not eating a proper diet because he wants to reduce weight and he is doing crash dieting. Because of that, he has got backache. This you will also get in lots in your practice. So we have remedies. We have patient doctors telling lycopodium, ruta. Yeah, these remedies we have. But what symptom you have taken for prescription is very important. What symptom? That is very important. Of course, Ruta is, see, if you don't understand backache, of course, you can take always Ruta, Ruta is there, Astoxlaco is there. But what is the symptom that you have to take? That is important. Anybody? I took the rubric, I took the symptoms, backache from fasting, and the remedy which I gave, very good, Dr. Babel, that is Kali nitricum. You could have never thought Kali nitricum for backache. But whenever the patient comes and tells you that after fasting there is backache, please try to give Kali nitricum. It has given me very, very fantastic results. Very, very fantastic results. Of course, when the patient comes and tells you that a backache is because of lifting weights, lifting, okay, he is doing some household work, he has lifted mattress or table or chair, and then the backache is there, then you can think about calcarea carb or lycopodium or rust tox or graphitis or even nux vomica. But when the patient comes and tells you backache is because of fasting, my dear doctors, do think first about Kali nitricum. These days, we have got the results of NEET and medical entrance exam. But a lot of students come and tell us, okay, sir, I have a severe backache. I've been reading day and night 10 to 15 hours every day for NEET preparation, for engineering preparation, and I'm suffering from backache. And then we always say that there's a posterior problem. You sit for long, that's why there's a problem. So we prescribe Rustox, we prescribe Ruta. It does not work. I had a lot of cases where in this examination, when the patient comes and tells you that I have been reading day and night because I want to clear my exam. This is backache from mental exertion. And whenever you have backache from mental exertion, think about chamomila, think about Kali carb, think about a very, very important, though infrequently used medicine, think about thymol. Of late, everybody in India must be understanding, because just the NEET results have come. Somebody have done good, somebody have not done good. But we had a lot of cases where we understood that because of a lot of sitting there was backache. But in this condition, think a symptom backache because of mental exertion. I have prescribed 3 remedies which has given me good results: Kali carb, chamomila, and thymol. So don't have a prejudiced mind. Understand what the patient is trying to tell you, what the constitution is trying to tell you, and then prescribe the remedy rather than just prescribing Rustox, Ruta, Belisper, Arnica, Goicam, Goltheria, Calcareca, Graphitis, Nux vomica, Lycopodium. These remedies are there, but exactly here are the symptoms of the patient, and then prescribe the remedies. I am telling you this remedy, mental exertion. I had a case where the patient was preparing from NEET. I gave him chamomila, Kalika, worked fantastically. And the patient came, he scored fantastically NEET exam, above 600. And the patient came to give me sweet, sir, your remedy for backache worked very well. I had no problem with that medicine. And that's why I could score this marks in NEET. That is what we want from our patients. That are the results which we accept from the patient. And that's why your interpretation is very, very important. The interpretation of symptom will guide you the remedy. So make sure your interpretation is very good. I would say very much perfect. Whatever the language the patient is telling you, that language is being given in a mater medica. If possible, there are some of the cases where beautifully the whole case the patient has prescribed, the patient has told the symptom at verbatim what is written in a mater medica. That is the beauty of a proving. So let us go immediately, and Dr. Megha, welcome. Dr. Ritu, welcome. So let us go to the question answer session. Anybody having questions? Don't let me tell you some cases, because by the time you start asking questions, the half an hour will be over. Anybody? Forget the backache now, come to the question answer session. In question answer, I also learn, so it's very important for you to ask me questions so that I also brush up my mater medica. Wine 208. Welcome. Villain. You have very, very, scary names, Well, all are welcome. So if you don't have any questions, let us have some another symptoms of backache, because of late, a few students have come to give me sweets, and the remedy have worked wonderful, 3-4 remedies which I told you. One type of backache, whenever the patient comes and tells you, remember the symptom now, that any remedy to gain weight, if the patient is malnourished, there are a lot of remedies, to gain weight. You can think about remedies that would stimulate the appetite if there is loss of appetite. But normally in homeopathy, there are a lot of mother tinctures, If I'm not wrong, then alfalfa is given, Avena sativa is given, lecithin is given. These are the remedies you can give in low potencies in repetition, and that would help in weight gain. But if the patient has having a primary problem in sora, make sure that you address that first and see the cause of weight malnutrition or loss of weight. Then it is easy to prescribe. Yeah, welcome Dr. Palak, Dr. Rajendra Rao. Yeah. So I was telling you here this symptom of backache. Patient आके बोलता है, the patient comes and tells us that if I don't pass my urine on time, I get backache. See the line of the patient. Acute symptoms. The patient says, if I have a nature's call to pass urine, I have to pass, otherwise backache starts. Which remedy comes to your mind? Such a very, very interesting symptom, Alpha malt for weight gain. Yeah, malt preparation is very good at honey, so you can definitely alpha. I was telling about the alfalfa mother tincture. Alpha malt basically is a patent product. You can give alpha malt also. It's a alfalfa mixed with malt, that is honey. It will definitely improve the weight. Sir, can we help a patient in ectopic pregnancy? I would say very difficult, Dr. Navjot, but definitely you should give it a try. I had cases. I have 2 cases in my past, where about 3-4 years back, and I have lot of cases of placenta previa treated and cured with homeopathy medicine. So definitely we can definitely help these type of cases. Of course, you must know when to tell no and when to operate those cases. That's important. Good afternoon, Dr. Paul. If urine not pass on the swelling in also, yeah. It was not so much urine, so much anuria, Dr. Arora, that the patient is swelling in the limbs. Just I have to go to urine now because I'm doing the YouTube and an Instagram live, so I'll wait for about 10-15 minutes and then go for the urine. But these cases tell us if I wait for that time also, I get backache. That's what I'm telling you. These are the symptoms of the patient, and sometimes when you read in the mater medica, we find such a symptom, it will never come. But in my 20 years of practice, I have seen everything which is written in the mater medica. You can hear the patient telling you. Okay, so I was asking that type of patient having increased creatinine level about 1.6 with hypertension. Sir, patient complain about lower abdominal pain and passes stools, dryness of mouth. Dr. Srivastava, this is a chronic kidney disease called as CKD, and the cause is hypertension. So first, make sure that the patient's blood pressure is treated properly and that comes to normal. Because if the blood pressure does not come to normal, the creatinine will go on increasing, and that will be a very bad state to the patient. In this case, it is important to manage the blood pressure. If the patient is taking allopathy medicine, what I do not stop the blood pressure medicine. I tell the patient to continue for some time, and as the pressure comes to normal, as the creatinine level comes down, automatically then I start tapering of the dose. But directly, I do not taper off the dose of either antihypertensive or anti-diabetic medicine. When the patient comes to me, I wait for some time and then start tapering it off. Rustox, okay. Any other remedy? You must see. This is the beauty of homeopathy medicine. Rustox is definitely there. Any other medicines? What could be interpreted if the patient during casting said it depends? It depends for every question asked and follow it with an answer. What possible rubric? Just want a point of view. It depends means the patient has basically is not totally sure whether what he's telling is right or wrong, first thing. And second, the patient is more worried about the situation. He's more worried about the environment. Okay, depending on the environmental situation, his questions or his answers depend, or his state of complaints depend upon. That is what the patient is trying to tell you. That means the patient is more dependent on others' observation, on what people think and then it decides. That is the answer for this question. And I have also a lot of patients who say it depends, actually आपको पता है ना, ऐसा तो होता ही है. These are the typical wordings the patient comes and tells us, and the interpretation is this, what you have asked me the question. Sulfur, no. Dr. Palak, you must think about two remedies, very, very important. First is natrum sulph, second is arnica. Of course, there may be a lot of remedies in the repertory, but natrum sulph and arnica have given me very good result, or I could say I have never failed when the patient comes and tells me that whenever I have to urge for urination, I have to go immediately and leave all the work. Otherwise, backache starts. Yeah, natrum sulph. Yeah. Severe ureteric pain remedy gives some light. Yeah, whenever there's severe ureteric pain, I have told Pararia brava, hydrangea, colocynth, belladonna, berberis vulgaris, depend on the pain, bubbling pain, stitching pain, electric shock like pain, radiating pain, lot of things are there. Thanks for good explanation for it. It depends question. Thanks. Yeah. Thank you, Dr. Evelyn. And these are the very, very important, whatever you have asked is very, very particular in clinical practice. There are a lot of things, which are basically told so many times by the patient, and that is the rubric and that is the remedy of the patient. Of late, because of the heavy practice, heavy patients flow, and a lot of other things in my life, I have been not able to take Google Meet, for you all students. And I'm itching to take that Google Meet to show you the results of homeopathic medicines, where we have cured so many cases by just good interpretation. Some metaphor rubrics which basically I always tell in my international webinars which I take, but I'm itching to take Google Meet for our students, because Hindi version is important, and you'll be surprised how an interpretation can cure a case which is so difficult. So I'll be coming in to Google Meet. We are working on that, and my assistants are there because they have to manage, because I just have to give a lecture. So we will be in short doing that. So my mother is having blood sugar fasting 147, eating 160 by 28 days, 105 fasting. She had little stress few days back. Physically she is better. She shared a stress with me for which she relaxed. I want to discuss with you. Maybe I had got your message yesterday, but let me yes, last time in the last Instagram I told the doctor was thinking that the creatinine is going up, that's why the sugar is coming down. It is not like that. Because of her constitutional medicine, the sugar is going down, and maybe she'll be cured of diabetes also with that medicine. Just wait for some time, and I'll hear you on your tension of mother on the WhatsApp. And on the phone I'll call you. Okay. Welcome, Dr. Simran, Dr. KF. My thrombocytopenia along with itching in dorsum of feet remedy. See, first of all, the patient is 83 years of age, so the immunity as such has gone down. In this case, don't prescribe on specifics. Very important to understand, if you prescribe on specific, you'll be suppressing one, curing one, and letting others go up, because the patient might have a lot of disease like mild sugar, mild diabetes, mild hypertension, mild thyroid disorder, everything mild. So you suppress one and it's something else increases. In this case, make a balance, make a homeostasis, give a consult remedy, maybe in LM proteins in repetition, and then you will get good results. Don't prescribe on this thrombocytopenia and all. Okay. There may be a lot of remedies, but I would not tell you to go on those lines. Whatever mistakes I have done in my practice, I don't want you to, because see, when the platelet count is low, we try to give carica papaya, nothing works. It's important why, and there is a mild infection every time in senior cases. Take that case and prescribe a dose that would be helpful in your practice. If you cure one, it suppresses the other, and the case becomes bad and bad. I've attended a webinar on injury. It was amazing and knowledge. I got a great. Thank you so much, Navjot. Good afternoon, sir. Still, please, when a patient comes of skin eruption after taking allopathic medicine, now no eruptions are seen, how to go about in this case? Very nice. Just wait. Just take the whole case, consult medicine, wait, give placebo. Let's see how does the body react, whether the body comes out with the same skin symptom, or when skin is suppressed, body comes with something else. Wait and watch. Give item. Don't do anything. Bilateral deltoid pain more at right and moving arms better by rest. Do suggest the patient not relieve with Brahmi and Phytoleca. See, whenever you have a case, whenever I hope the patient is not diabetic. I hope the patient is not diabetic, Dr. Indrajit. See, whenever the patient is diabetic, then basically, we have frozen shoulder and there's a lot of pain in the muscles. But in your case, if the patient is non-diabetic, just you want to know the remedies for muscle pain. 3-4 remedies, very, very important. You should remember causticum, colocynth, lycopodium, calcarea cup, of course, ruta rustox you have seen. These are the remedies that you should take care about. What medicine is used, sir? For what, Dr. Nigam? Welcome, Dr. Sisodia. Some black spot at both soles, change like as dry eczema. In this case, you must think about remedies like petroleum, calcarea, lacasis, crotalis. These are the remedies for black spots. A patient with clear indication of Senna, clear picture and also diagnosis, you would only give Senna. From lab report shows kidney disease. Would you only give Senna? If you are very sure that the patient is Senna, then you should give Senna. I think we did a case of dysmenorrhea, Dr. Alexandra, where we prescribed cantharis to the patient. Last our Zoom meeting, there was no indication of cantharis, but if the symptom similarity is there, I think that remedy should be prescribed. Yeah. Don't worry about the rubrics what Senna is prescribed. You can go, because if you remember a case of mine where there was a triple vessel disease where I had prescribed the patient viola odorata and all the blocks were removed. So viola odorata does not have any symptoms of the CAD, but still it worked. So if the symptom similarity is there, the remedy has to work. That's important. Okay, so thank you. Non-diabetic, yeah. So Dr. Abhijit, earlier patient had psoriasis of covered parts. After medicine, his complaints aggravated and now have covered his feet, hands and face, itching at night, obstructed sleep, emergement warm, arsenic failed. Dr. Abhijit, if you have heard my psoriasis lecture on Instagram, on YouTube, a lot of times, I have been always very clear. Psoriasis is because of suppression. Psoriasis is because of when he wants to do something, he cannot do something. Will contradiction of antagonism with himself or dominance of somebody, where the patient's thinking process is changed by somebody or suppressed by somebody, and that's why the skin starts multiplying, and that's why psoriasis occurs. So this is the concept you must follow, and don't look at the modalities in psoriasis, because some are aggravation in summer, some in winter. This angle of mind has given me most of the results, very good results in psoriasis. For your learning, sir, I got confidence while treating patients. My clinic is near my husband's clinic. She sends me case which is not treated with allopathy. When that patient's cured, I feel proud of homeopathy. Last day I cured a case of chronic hypertension. Case is not cured with allopathy. Wow, fantastic, Dr. Ramjot, and I'm very happy that you're practicing besides your husband, and it is always very mutual. Both science are very good. In allopathy, something is good, homeopathy, something is good, and we get knowledge of a lot of disease processes in allopathy. So that's also important. But I'm very happy and proud that with some distant learning, people are getting good results in their practice. If possible, next time you can share your case so that everybody can learn from your case and what remedy you gave. Thank you so much. Dr. Richa, welcome. Pimples on forehead, black color, medicine's name, sir. Such a specific question, pimples on forehead. And these type of questions are very good. Absolutely on dot, on. Let me tell you the most difficult case which I find to treat is pimples. First of all, I don't try to treat pimples only, because it is always Herring's law of two eliminations basically in our mind. But if the patient comes to you with pimples on forehead, 3-4 remedies very, very important, Dr. Saurabh Kumar. First is antimcrude, second is Naxomica, third is Nantramur, fourth is creosote, and fifth is rust toxicodendron. These are 5 remedies which I have used, which I used to use a lot in my practice, but of late, Herring's law of cure and that basically starts coming. So I don't use that. But if the patient comes only with pimples on the chief complaint, these 5-6 remedies are very, very important. Of course, There are so many remedies, in this case, psoriatic symptom, remember one thing, you have to differentiate whether the patient is hot, whether the patient is chilly. If the patient is hot, write down the remedies. 3 4 remedies very very important. First is natramur, second is sulfur, third is bovista, fourth is lycopodium, and fifth is ledampal. If the patient is hot, same case, forehead problem, the patient is chilly. In chilly, the remedies changes. So, antimcrude, creosote, nux vomica, rustox, and sepia can also come. So, differentiate hot and chilly, and you can easily get to the remedies. Your pimples are also cured with medicines. Very good, Dr. Anjo. Thank you. Sir, how to manage? Can I share my case here in future? You can share me on my WhatsApp, because here we are basically asking questions and we have no time as such. But if you got some release with some COVID medicines, you can always share. Sir, how to manage patients of pharyngeal disease with slight risk RTF? Yeah, real CAD cases, CKD cases are very, very difficult to handle. Let me tell you also, I have also very difficult. But let me tell you, lot of cases, lot of promising results are there. We can at least stop dialysis. We can at least stop the increase of creatine very well in with our homeopathy medicines, and this is a boon to all patients, because in allopathy or other orthodox science, the only treatment is dialysis. Patient goes for dialysis 1 year, 2 years, he's tired, the body goes down. In fact, I have been treating my relatives, my father also, for the past 15 to 20 years for the same problem. Absolutely no problem. Creatine maintained till date. Yesterday we did with 1.5. So fantastic results homeopathy. There are some entry points that you should remember in case of CKD. When I start my Google Meet, I'll share my experience on treating CKD. Very good results. Homeopathy has lot of scope in treating CKD and CRF cases. Take the case. In future, if possible, I'll share a few of the cases which I have cured in my practice. Melasma case, scope of homeopathy. Before that, we have can we make combination of carbohydrates, Naxomica, Robinia, anti-improve? So, I don't know, Dr. Or I have never used it, but I've seen doctors use it. You use it and tell us how does it respond. I can't comment on that. Sorry. Melasma, again, very, very difficult case, to cure. But if you go in the repertory and chapter of face, there are cases where there is discoloration, blackish, earthy, ashy, bluish on forehead, on cheeks, on. You can go home and basically try to repetize in those rubrics, and you'll get the answer to that. 1 year child, diarrhea 6 months, increasing last month 10 to 15 times, admitted to the hospital for 24 days. Diarrhea controlled but progressive splenomegaly with thrombocytopenia, FFP given 2 times. See, you must understand, Dr. Shoaib, the body, the constitution is trying to show symptom through the rectum. This is the showing symptom, but actually the disease has started from the mind. So understand, why did the patient suffer from this, and why did the body had to eliminate through rectum. In this case taking of the child and the history of the child during pregnancy is very important. That would give you the remedy. In these cases, 3 4 remedies are very very important. What I can see in the case: first is phosphorus, second is carcinosin, third is sulfur, and fourth is sorinum. You should look over these medicines and go to the case taking again of the child and the condition of the mother during pregnancy. That would give rise to the answer. Welcome, Dr. Aarti. I've told you, these are the approach you must take in those cases, and then you'll get good results. Yes. Some questions have. Okay. Gastroenterologist, hematologist opinion taken. They suggest for a goucher disc anemic pack. Yeah, whatever they suggest, right? It's their part of you. Our is case taking in the fetal life and the first year of child, or in these type of cases, simple elements from vaccination also it happens, and then the patient goes into this problem. You can think about thuja, you can think about other remedies of vaccination, vaccination, hippozinum, lot of other remedies. Dr. Rajesh Vedya Center request to be in your live video. Okay, so this basically was for today, and I hope. There are few questions more. Yes, so we have already done with half an hour, but still few questions. Live video, I can. Dr. Junaid Malik, view request. Okay, we have on the verge of finishing this session, and thank you everybody for in fact spending time with me half an hour more, because we could not do it on 2:30 and because of the rush of the OPD. So thank you for being with me, though there was a change of time. And maybe sometimes we'll meet in the Google Meet and try to show some cases to you. Okay. So I hope everybody joins in the Google Meet which I take. So thank you very much. Thank you everybody for joining me. I hope you enjoyed as much as I enjoyed teaching you. Thank you so much.